Hello, ladies and gentlemen, and welcome to episode 10 of the Storytime Clinic. I'm your host, Dr. Mfon Umoren. I'm a pediatrician and a lover of children's books. Usually on this podcast, every week I am discussing a book that features a child with a chronic health condition. And we talk a little bit about the health condition, about what the experience of living with that health condition might be like for the child. Once in a while, I will have a guest episode where I invite someone who is able to give us a little bit of a different perspective in terms of working with children with health conditions. So today I have with me Kendra Felder, and we are going to be talking about child life. So, Kendra, welcome to the show. How are you doing?
Thank you. I'm doing good. How are you?
I'm doing very well. And Kendra has just finished her master's in child life, recently graduated from Azusa Pacific University. Is that correct?
Yes.
Very good. All right. Well, before we get started, I have a quick question for you.
Okay.
What was one of your favorite games as a child? What did you like to play?
I can't think of a specific game. I know I like to play house, and I had a lot of dolls and stuffed animals. But I also like to go outside, and ride my bike and just play outside with my sisters and my friends in the neighborhood.
Right.
So,
yeah.
It's very outdoors kid.
Yes. I think outdoor time is so important for children. They need to be out there running and falling and getting scrapes and just staying active generally. So that's a great answer.
Yes.
I think one of my favorite games was called Ludo. And I don't know whether you've heard about Ludo.
I have not.
Okay. I grew up in Nigeria, so it's probably not a Nigerian game really, but it's it's the same thing as Sorry over here. So it's a board game that you move the pieces around and you try to get them home. And that was one of my favorites.
Fun.
Yes. So we will be talking about child life here. And when I say child life, I'm not just talking about the everyday life of children. Why don't you tell us a little bit, Kendra, about what we mean when we say child life?
All right. So child life, or having a child life specialist, as the profession is known, it's a trained professional. They're trained in development of children and just have expertise in working with children in hospitals, specifically, and helping them cope with hospital stays, whether that's long-term or short-term, through interventions. They might educate a child on a diagnosis or a sibling's diagnosis, or provide some type of an intervention to help them understand just the hospital experience better.
Yeah, it sounds like you guys do several things there. So there's the education aspect, there's helping children cope with their hospital stay, and it actually incorporates a bit of the family as well. So not just focused necessarily on the child that has the health condition, but on the whole family aspect as well. So you guys really kind of support the psychosocial aspect of illness, I would say.
Yes.
Now, this is not a profession that I knew anything about before I was a medical student. And in one of my pediatric rotations, I had an interaction with a child life specialist who helped out with one of our patients. So this was in a blood disorders clinic, and she had to get a vaccination shot. Naturally, as any 5-year-old child, she was already, squirming and whining before any of the equipment came into the room. And I was like, oh, Lord, we're going to have a meltdown. And then all of a sudden, this woman floated into the room and came to the child's side. She had her iPad on there and started playing an interactive game with the child. So just kind of distracting her, getting her to blow bubbles with the game and to blow flowers in the wind with the game, up to the point where the child ended up getting the shot and she didn't even know it had happened. Like, she barely moved, she barely turned around, it just happened. And I was like, this is magic. So what goes into that kind of interaction? What was happening there?
So the child life specialist would have been doing distraction as their intervention. And so for like things like IVs or shots, a lot of times child life specialists will go into our room and they'll come with an iPad, or if it's like a young child, a book or something to like deter their attention away from what's happening. So they're not there to explain necessarily what's happening, but they are there to provide that distraction. So like in that case, the child didn't even know the shot happened because she was so focused on something else.
I thought that was just amazing. And, you know, especially for our children who are hospitalized for a long time and end up going through a lot of different procedures, you know, this is something that can be very helpful for them. Some of you listening might say, hey, we all got shots as children, you know, and we survived, we got through them, we cried, and we kind of got over it. So what is the importance of, you know, some of these things that a child life specialist can do? Why does that really matter?
Well, it helps just like overall, just especially in the hospital, bringing that sense of like normalcy to being in a stressful and unknown environment. Even like long-term patients, it's interacting with them, it's providing socialization, ensuring that their developmental needs are still being met, at least in the social aspect of like bringing them to the playroom. They might interact with other patients. Or just finding ways to help them in that process of a long hospital stay. So like child life just helps them keep on track with where they are developmentally.
Absolutely. I think that can be so important. You may have children with things like cancer or other complex medical conditions who spend a significant amount of time in the hospital. You're talking about months. So sometimes those children are isolated from their usual group of friends. They might be out of school where they would also be interacting with other children. And a lot of times they might be nervous and anxious about the things that are happening in the hospital. You know, a lot of it is new to them. A lot of it is out of their control, you know, so having somebody there who is able to kind of walk them through the process, make it a little bit less traumatic, I would say, because if you're getting one shot a year or, you know, one visit to get shots a year, it's not that big of a deal. But if you're having, you know, multiple blood draws, multiple procedures, things like that, a new imaging scan or something happening every other day or every week, then you kind of start to build up a little bit of anxiety about what is going to happen in the next procedure. Is it going to be painful, this and that? So in my department, I've seen our child life specialists do excellent work with children just to kind of help them through these kinds of situations. And so I definitely think that it's a very useful thing to be able to have.
Yeah, and with like patients who are long-term, who might leave school or have to be out of school, not leave school, be out of school, a lot of times, like once they get to the point of being able to return to school, sometimes depending on where their child life specialist is, they can go into the school and kind of like explain to the class maybe why a student has lost hair, or why something different changes that the student might have gone through while they were in the hospital, to make it more comfortable for the student, for the patient themselves, and then for their classmates. Them.
That would be very, very helpful transition. That's another thing that a lot of children tend to be nervous about if they've been out of school for a while. It's like, how am I going to get back into my friend group? How are they going to see me? And
it's like not just children or patients who have cancer, just like any situation where a child might not be comfortable necessarily going back to school.
Wow, yeah.
Child life can definitely step in and help with that transition or reentry.
That's good to know. I actually did not realize that part. Yeah. So you talked as well about education, and that's one of the things that you guys might help a child with while they're in the hospital. Tell us a little bit more about what that would look like.
So education, or we call it diagnosis education.
Okay.
So that could be anything from explaining a tonsillectomy to a child, or someone who has to get their tonsils out, where it's not like a huge emergency. You can take the time to explain like where the tonsils are, and then like what the process of that might look like. Or it could be working in the neonatal intensive care unit and working with a sibling who has a new brother or sister who's born early, or has to have like a special type of treatment in the NICU, explaining that to the sibling. So when they go in, if they're allowed to go in, it's not scary. So it's a wide range, but it's really educating both the patient and the family and helping them understand in a child-friendly way the different things that are going to happen. Because you have your doctors and nurses are just using medical terms that sound scary. And so we bring it down to the child's level so they understand what's going on.
Yeah, I think that's so important because a lot of times as a doctor, I might be more focused on explaining to a parent what is happening and what their child needs. Sometimes for the adolescents, I might take a little bit more time with them to just kind of incorporate them in the conversation. But really, a lot of times, I think our natural focus is on making sure the parent knows what is happening. And, with the child, we might just be like, you're going to have a procedure and, we need to do this for your health. But we may not remember sometimes to make them part of that conversation and to really do it in a way that they can understand what they need to understand, and as well just focusing more so on kind of preparing them mentally for the experience rather than explaining every part of what's going to happen. So I think it's useful, definitely helpful when there is a child life specialist or someone who can really focus on that child and bringing them into that process, because after all, this is happening to them. So I think that's excellent. And we read a book together actually for this episode that was written by a child life specialist. This is called The Hospital Bedtime Story, and it was by Jessica Ehret. And one of the things I really like about this book is that it had a picture page on there that showed a child life specialist and showed exactly this thing that you're talking about, is kind of a process of educating the child. And there was a couple of little toys in there that were kind of little replicas of what we might see in a hospital. So a smaller CT scan, a small stethoscope and thermometer, and things like that almost look like toys that the child could play with. Is this part of what you guys typically do with children?
Yeah, I think a lot more with like children who are like of school age.
Okay.
Just explaining and giving them, depending on what the procedure is, giving them real equipment that might be used, or letting them feel like an IV and see like how an IV is just like a tube. It's not like a needle. And then a lot of times we use medical dolls to help explain different procedures. So like we might have them play with the doll and like give them tape or give them a Band-Aid or give them something that they're going to have on their body after they get whatever procedure they need done. And then with like, I think with younger patients, it might not be so much using that like mini equipment. It's just letting them play, and like a lot of times with younger kids, they're like fears or questions might come out while they're playing, and then you can answer them that way.
I see. Yeah, that's actually really helpful, is having just almost like an environment where the child feels free to speak up about something that they may not have had an opportunity to talk about otherwise. Yeah, yeah. And yeah, in our department, I've seen some of those dolls that you mentioned. So if a child is going to be having a port, which is a type of central line, a permanent central line that's placed under their skin, they might have a teddy bear or a doll that looks like that, and the child life specialist will go in and talk to them. And I've never sat in on these on these talks, so I don't know exactly what they say, but I know that the doll exists, and so and it shows when the port has to be accessed by a needle, what that would look like, because this is something that the child is going to need to go through multiple times. So again, I think it's that idea of there's a lot of uncertainty for the child in the medical environment, because a lot of things are new. And so that idea of just being able to make it a bit more familiar and preparing them ahead of time. Yeah. Yep. Yeah. That's great. Did you have any other thoughts about the book?
I just really like how she explained, like, because the book was about a child who was staying overnight at a hospital. And so explaining that how that environment can be scary with all like the sounds and beeps that are going to be in the room, and just kind of finding ways to like deal with that and like cope with that specific situation. I really liked it.
Yeah. I think she did an excellent job of, like you said, describing all of these things, the sounds and the smells and the different staff members that the child would see, and, some of the emotions that the child was feeling, feeling a little bit worried about being in this different place, and she'd rather be in her bed at home than in the hospital. But then there's people that kind of made her happy and made her her hospital stay a little bit better, and that was probably the child life specialist, because I'm almost positive that most of our children in the hospital, their favorite staff members are the child life specialists, because they get to spend so much time just being a kid and doing fun stuff with them. So so that's nice. Now, do child life specialists only work in the hospital itself, in the inpatient areas? I know you mentioned possibly in the NICU or in a procedure area. I think sometimes they might work in the emergency room as well. But I've only encountered them mostly in the hospital setting. Are they able to work outpatient as well?
They are. Right now, you would typically find a child life specialist in a hospital, and generally in a children's hospital. And so, like, if you were to take your child to just a general hospital, you probably wouldn't see a child life specialist there. But I feel like most children's hospitals have a child life specialist to offer services to them. And then outside of the hospital, I think it is a goal right now to get as many child life specialists out into the community. I've heard of the idea of child life specialists in like foster care centers or like adoption centers.
Oh wow!
Like working with like grief programs.
Okay.
Like community centers. I know there's a big push for having child life specialists working in like disaster relief areas to help cope with those situations, because it's all stressful.
Yeah. So I guess there's a lot of potential applications, really, anywhere that there's a child involved and a situation with some uncertainty, potentially a stressful situation involving medical or healthcare in some sense. I think that there's a lot of application out there for that.
Yeah.
So when I initially started working alongside child life specialists, I will confess that I thought it was an awesome job, but I thought that most of what it entailed was just kind of playing with children. I was like, oh, that's the specialty that plays with the kids, and this must be such a fun job. They just get to go in there and play with toys and all day. But as I've continued to work with them over the years, I've realized that there's really a lot more that goes into that job, knowing how to work with kids of different ages, how to communicate with them in ways that makes sense for where they're at, how to work with kids with different medical needs, autism and the like. And there's a lot that goes into it. So from a training perspective, I'm interested to know what is it like, or what does it take to become a child life professional?
Yeah. So there are like kind of multiple routes you can take. Right now, you have to have a bachelor's degree in generally any field, but I feel like a lot of people either get their bachelor's in like nursing or psychology or something along those lines. And then you have to take 10 very specific courses. I'm not going to name them all because I'm like not off the top of my head. But one has to be taught by a child life specialist. Or this just like most recently you have to have, or you could have a degree from a program that is endorsed by the Association of Child Life Professionals. That or a bachelor's degree in those 10 courses. And then
I see.
That's just the academic side. And then clinically, you have to have a 600-hour internship that must be in a hospital. So, it's a lot, but it is it's a rewarding career choice.
Yeah. So those 600 hours is your hands-on kind of experience with children and in those situations.
Hands-on, like working with patients in the hospital.
And you mentioned that you guys do, you support a lot of the development of children. So some of those courses that you talked about, you might have some human development or child development courses, I would presume, and maybe some psychology as well.
It's a lot of it is based on development. So a lot of like adolescent development courses, child development courses. We take a play course, so learning how to use interventions.
That is what I was about to ask. Is there a course on playing, how to play?
Yes. That was one of my favorite classes in my master's program.
That is fantastic. Yeah. I love it.
So we take a play course, and then on like the cover side, we have to take a grief course. So learning how to work with patients who either are reaching the end of their life or working with siblings who have a sibling in the hospital who's reaching the end of their life and helping them through that transition.
Yeah. So I guess it's not all fun and games. There's yeah. And so actually I am hoping to do another episode, a guest interview with a child life specialist where we can talk a bit more about this aspect about the grief and bereavement and what their role can be in that situation. So I think that'll be a really good one to hear about. I'm looking forward to that.
Yeah.
If you do you have any resources or anywhere you could point someone to who may have been inspired by your interview to become a child life specialist?
Yeah, if you go to childlife.org, that is the Association of Child Life Professionals main site. You can find basically anything you want to know about the field. One thing I forgot to mention is after your internship, you can start working in the hospital as a child life specialist, but you do have to sit for a certification exam within a year of taking that job or before you get the job. And you have to have that internship to be able to sit for the certification. So it takes a lot, but childlife.org will point you in all the directions.
Okay. Very good to know.
Yeah.
All right, Kendra. Well, I really, really appreciate your time here. I appreciate having you on the show and sharing your expertise in the child life field with us. I think I learned a lot about what you guys do, the full scope of what you do in the hospital. So thank you so much for coming on here.
Thank you.
All right.